Chapter 17. Historically, old age began at 65 or after retirement, but today it's harder to pinpoint since so many older adults are living active lives, some continue working until well into their 70s or 80s, some are raising young children, and rates of longevity, thanks to modern medicine, are soaring. Although many older adults do experience declines in their physical and cognitive functioning, they typically also find more peace and life satisfaction. Many find hope and meaning through religion. In Western cultures like the U.S., ageism is perhaps more common than racism and sexism, and youth is preferred. But in cultures like Japan, older adults are revered, respected, and taken care of because they possess the highest levels of wisdom. Some people fear that old age brings a complete personality change or view it as a disease. That is untrue. Aging is not a disease, and people don't radically change overnight. Those who age with the greatest success are able to maintain positive attitudes, stay connected socially, exercise, maintain their body weight, and eat healthy. The oldest old, those centenarians over 100 and supercentenarians up to 120, are often able to escape common illnesses and diseases until their 100s. Just before they die, they usually experience only a brief decline. Personality traits seen in those who live the longest include low neuroticism and high rates of extroversion, conscientiousness, openness, and agreeableness. It's also important to feel some autonomy and efficacy. We see cultural differences in longevity, with those in undeveloped countries living fewer years, maybe just to their 50s or 60s, versus the U.S. average of 78. However, rates of older adults are increasing at higher rates for countries that are developing versus those that are already developed, so this might change over the next several decades. Dan Buettner has identified blue zones, or areas where people live the longest: Okinawa, Greeks in Icaria, Costa Ricans in the rainforest, Seventh-day Adventists in Loma Linda, California, and Italians in Sardinia. In the case of the Seventh-day Adventists, they followed a vegetarian diet and weighed less than people who ate meat. With their lower weight, they also had a lower risk of heart disease, cancer, and prostate problems. So is nature or nurture more impactful with regard to longevity? Is it our genes or how we live our lives that determines how long we'll live? Some studies suggest we're in control of our aging and that 4 things are vital: a future orientation, the ability to cope with stress, an active lifestyle, and strong social relationships. Other studies have discovered similarities in chromosome 4 among centenarians and believe that there may be other age-defying genes. There are 3 times more centenarians in Nova Scotia than in the U.S. Nova Scotian centenarians number 16 times more than across the world's other countries. The number of older adults and very old adults is growing faster than the younger age cohorts because of the declining fertility in younger people and increasing longevity, both because of medical advances and because the quality of life is increasing, which results in a longer life. Eventually, older people will outnumber younger ones, which will have significant impacts to our culture, both in terms of their sway in politics, likely resulting in legislation that represents the interests and needs of the aging population, and in the impact to the economy, with greater healthcare costs and even with migration changes. Older adults typically prefer warmer climates and migrate to southern states, leaving the northern states with less income and the southern states struggling to accommodate a growing population. In the U.S., it's projected that by 2030, the 65 and over population will double in number compared to 2000. Currently, the older population is mainly white women. Minority populations aged 65 and older are expected to increase at higher rates than whites. The Hispanic population will increase by over 300% by 2050, and the Asian American and African American populations will also be tripling and doubling, respectively. Because minorities are statistically more likely to live in poverty, that may place greater financial burdens on the Medicare and Medicaid systems. With the aging population, problems like hypertension, arthritis, heart disease, cancer, and diabetes will be common healthcare issues. Because there are fewer younger workers paying into Social Security, it's long been projected that the program would become overburdened and unable to keep up with all of the retirees needing income. Originally, experts thought that would happen in 2018, but it came sooner, in 2011. The graying of the U.S. budget has become an ongoing discussion, and some suggest that simply raising the age of retirement would help, from 65 up to 67 or beyond. To dispel some myths, not all older adults have to live in nursing homes. In fact, the rates of nursing home residents are actually decreasing. It's only 4%. However, while rates may be going down, it's predicted that with the growing elderly population, nursing home residents overall will increase. Older adults are not all bedridden or severely disabled. Only 4% are bedridden, 9% are homebound, 5% are seriously incapacitated, and up to 16% have restricted mobility. The majority report that their health is good to excellent. In 2008, only a quarter reported their health to be fair to poor. However, rates of poor health are higher for minority populations, a third of whom report their health to be fair to poor. Acute illness is actually rarer for the elderly. However, the elderly have an elevated risk of chronic problems like hypertension, heart conditions, arthritis, diabetes, and osteoporosis. Since their antibodies are built up, the elderly can more easily fight off common infections like the cold and flu, but they are less able to fight off more serious conditions, take longer to recover, and are more likely to develop other complications. Most do not have prolonged declines going on for years, but maintain relatively steady health until a short terminal decline 90 to 120 days before death. The picture of gradual aging may soon be replaced with health and vigor up until the end of life, with the more sudden senescence, which is mental decline in old age, or physical decline. The elderly are not the cohort most often victimized. Those aged 16 to 19 are. The elderly are actually the least often victimized. Not all elderly people are starving. Most are in better financial shape than in previous decades. Most do have lower incomes than younger people, but they also have a higher net worth, owning their own homes. The financial gap between men and women actually widens in older age, with women drawing less retirement income than men. Throughout their working careers, women typically earned less than men and thus have less to draw from. It's also more common for them to switch to part-time or quit altogether in order to care for family, and more women than men completely depend upon Social Security. Women over 62 account for 60% of all Social Security recipients. Women over age 85 account for 70%. 90% of Social Security goes to single women. Women outlive men. Their average life expectancy is 80.2, while for men it's 75.1. Some researchers believe that estrogen protects women against cardiovascular disease and boosts the immune system. Women also have sex-linked resistance to some terminal diseases. Because they have two X chromosomes, if one malfunctions, the other can kick in. If things go wrong with a man's single X chromosome, he's in trouble. And since both sexes inherit at least one X chromosome, many diseases are carried on that chromosome. The Nun study provided valuable information about which groups of women were least susceptible to developing Alzheimer's. The study was a close approximation of a controlled environment since the nuns all lived together, ate similar if not identical diets, and maintained the same routines. Autopsy results later showed that even though some nuns lived with no signs of cognitive deterioration, their brains did actually present with signs of Alzheimer's. Why does the disease only express in some people? We know that people with higher cognitive reserves are protected for a while, delaying the onset, but when Alzheimer's does strike, their decline is typically faster. In the Nun study, if while in their 20s they demonstrated greater linguistic ability, both in terms of their idea density and grammatical complexity, they were protected against Alzheimer's. Obesity is rising even among elderly populations, especially among women, increasing from 22% in 1998 to nearly a third in 2008. Obesity is highly correlated to serious problems like cardiovascular disease, kidney disease, cancers, joint problems, and diabetes. Recent research suggests that obesity might be overdiagnosed among the elderly. 60% of those over 60 have high blood sugar levels, perhaps because there's a natural reduction in insulin production as we age. Proper exercise can be used to control diabetes and reduce the risk of cardiovascular disease, which kills over 450,000 people annually in the U.S. and is one of the leading causes of mortality. Unfortunately, only 20% of those over 65 report regular physical activity. Exercise increases our lung and heart capacity, lowers blood pressure, increases muscle strength, leads to denser bones, faster reaction times, improved thinking, and overall cognitive function, better sleep. It lessens the risk of depression, and especially for women who have more fat and less muscle and bone mass than men, lowers susceptibility to bone fractures, muscle deterioration, and fall-induced injuries. Some have theorized that exercise increases longevity, but it's unclear if only strenuous exercise can add years. There's a point at which strenuous activity can be harmful to aging adults. Tai Chi is a gentle exercise and has been found to improve coordination, balance, reduce stress, and promote overall well-being. It has positive effects in treating arthritis, diabetes, chronic fatigue, and high blood pressure. Although older adults don't need to consume as many calories, they do still need just as many vitamins and minerals, perhaps even more, so that they can maintain their cognitive function. Vitamins and minerals and all medications are absorbed and processed differently in older adults, so their recommended daily dosages are different than those for younger cohorts. Older adults, particularly postmenopausal women, lose bone mass, so it's common to see osteoporosis and osteopenia, which is lower than normal bone density but not as low as osteoporosis. Thin and small-boned women, as well as those who were sedentary and who underwent early menopause, are most at risk. With osteoporosis, the bones are more porous and fragile, so even minor falls can cause fractures. Hip fractures bring higher rates of mortality in women 80 and older. After a broken hip, a third must move to rehab facilities or nursing homes. Those who are bedridden long-term can develop pneumonia, blood clots, and additional muscle loss, which often leads to earlier death. Although vitamin D can slow bone loss, it doesn't restore bone mass. However, some medications might, when combined with weight-bearing exercise like walking. As we age, the discs in the spinal column become less dense, which can lead to cracks and compression as they move closer together. This causes back pain in many. The upper back also begins to curve, making it harder to stand upright, and in some cases, making it harder to breathe deeply. Not only are different dosages of medications required for older adults, but sometimes medications that are intended to produce one effect produce the opposite. Sedatives often result in excitement and agitation rather than the intended relaxation and sleep. The aging brain and nervous system are particularly sensitive to antidepressants, which can lead to lethargy and confusion. Because the elderly don't absorb drugs as easily from the intestinal tract, their livers are less efficient at metabolizing drugs, and their kidneys less efficient at clearing them. For this reason, medications should be kept at a minimum. However, that doesn't always happen, with older adults seeing multiple doctors and specialists, acquiring multiple prescriptions, and engaging in what's called polypharmacy, the use of several meds, sometimes leading to unintended interactions. The elderly sometimes fail to take their meds on time, take too much, sometimes because of failing cognitive abilities. In those cases, devices can be used to help them remember when to take which medication at what dose. Although most older adults have good mental health, if they suffer from chronic disease or chronic pain, they're more susceptible to depression. In 2006, among people 65 and older, 12% of women and 5% of men were taking antidepressants. Throughout the lifespan, more women suffer from depression than men, but in older age, this trend can start reversing, with more men suffering from depression. And in men especially, suicide is a huge risk. We see higher rates of suicide among immigrants, those in care facilities with significant impairments, mobility problems, or cognitive issues. The suicide rate for adults 75 and older is the highest of all age groups, with men over 75 the highest rate. Many don't seek treatment for depression. Biological aging is defined as changes that occur in the structure and functioning of the human organism over time. Primary aging is time-related and is continuous. At first, up through young adulthood, aging brings a greater ability to cope and adapt to the environment. However, it generally leads to impairment in older age, jeopardizing survival. We most easily see aging through the physical changes. Hair thins, grays, and becomes coarser. Skin loses elasticity, dries out, and age spots may appear. And muscle loss begins, all at age 40. The condition sarcopenia is muscle loss plus the loss of skin elasticity, and that can lead to skin folds and wrinkling. Body height decreases as the cushioning material and the vertebrae of the spinal cord thin. It becomes more difficult to stand up straight as muscles lose mass and flexibility declines. Fat moves from the outer parts of the body, the arms and legs, to the torso. Older adults can't handle strenuous activities as they once could. By 70, the maximum oxygen intake declines substantially, so lungs can't keep up with the strain. All of that means that older adults have less endurance. Collagen is part of the connective tissue and serves to hold in place our internal organs, nerves, blood vessels, muscles, and skin, while still allowing us to have freedom of movement. Over time, collagen becomes thicker and less elastic, limiting our flexibility and leading to the hardening of arteries and stiff joints. Our senses decline with age. Loss in hearing, smell, and vision have been highly correlated to cognitive decline. Cataracts may occur, which is a hardening of the lens that limits vision, but the surgical repair for this is commonplace. The oldest old sometimes suffer from retinal detachment, which is serious. The retina at the back of the eye simply peels away. If caught early, through surgery, the retina can be reattached, but if missed, blindness results. People who have other health problems like diabetes, high blood pressure, or stroke, or who take certain medications, may also suffer from impaired vision. Hearing loss can result both from exposure to high-volume noises and also due to genetics. With sensory loss, adults have limited quality of life, often feel isolated, and sometimes lose their independence if they can't see or hear well enough to drive themselves or interact with others. Older adults also lose their ability to enjoy their food when their taste buds decline in number and sensitivity. People aged 70 to 85 have about a third as many taste buds as younger people. The ability to smell also declines, especially among those experiencing cognitive decline. And since the sense of smell plays a large role in our taste and appreciation of our food, that also contributes to the elderly failing to enjoy their food. Losing teeth may result in social isolation due to embarrassment and in the loss of important nutrients in hard-to-chew foods. Oral disease has been linked to dementia and Alzheimer's, possibly because the oral bacteria move to the brain. Swallowing disorders are common. Dysphagia can be caused by stroke, diabetes, alcoholism, TBIs, Alzheimer's, MS, and Parkinson's, and can obviously lead to malnutrition, dehydration, respiratory infections, aspiration pneumonia, and death. 60% of those in long-term care facilities suffer from dysphagia. The elderly can also suffer from late-onset asthma and chronic obstructive pulmonary disease, seen in those who smoked or were exposed to chemicals at the workplace. Hand strength and coordination decline with age, and older adults are less sensitive to changes in temperature, which can place them at risk of being exposed to too cold conditions for too long, resulting in hypothermia. This can be especially life-threatening since older adults are less able to maintain a steady body temperature in the cold. Hypothyroidism often explains why some older adults prefer temperatures at least 10 degrees higher than younger people. Hypothyroidism can result in a person always feeling cold, and thyroid problems are prevalent among the elderly. Sleep changes with age. Many go to sleep earlier, wake frequently, sleep for fewer hours overall, and experience daytime sleepiness and fatigue. Medications, illness and disease, and simple aging can all cause this. As we age, our circadian rhythms change, and sleep disorders become more common. Sometimes older adults suffer from sleep apnea, when they temporarily stop breathing repeatedly through the night, and restless leg syndrome, when their legs and feet tingle, prompting them to move their legs and feet as they sleep. Light therapy, counseling, and melatonin are often used successfully to help older adults sleep instead of medications. Older adults want to maintain a healthy sex life, and nearly half of those over 60 have sex at least once a month. About 40% wish they could have sex more often, but for many, their options are limited. Fewer available partners, difficulty with arousal, overall health problems, and the lack of privacy in retirement centers and nursing homes. Male impotence is the most frequent problem reported, but women also experience changes such as less lubrication, thinning of the vaginal walls, and shrinking of the cervix, uterus, and ovaries, all of which make intercourse difficult or even painful. Medication can help both men and women. Chronic pain and mobility problems also impact sexual interactions. STDs are most common during adolescence and young adulthood, but the next highest age group is the elderly. 10% of all new AIDS diagnoses are among those 50 and older. There are many theories as to why we age. In the wear and tear theory, the body simply wears down over time. Much like clothes wear out with repeated wear and washings, there's a natural limit to human life. Critics of this theory point to the fact that certain diseases can be delayed or even prevented altogether, and different parts of the body age at different rates. The error accumulation theory holds that the body's cells eventually develop errors when duplicating. When we use a copy machine to produce a copy, then use that reproduction as the original, over time the quality and clarity go down. The somatic mutation theory argues that mutations occur in the DNA, such as those caused by radiation, that can then impair cell functionality and healthy division. The genetic pre-programming theory posits that we are programmed to fail after a set number of years and have built-in obsolescence, much like today's cell phones, which are not built to last forever. DNA repair capacity declines with age, so DNA damage accumulates over time. The accumulation of metabolic waste theory, or free radical theory, argues that we slowly build up toxins over time. The metabolic process and the cell's use of oxygen naturally produce wastes called free radicals, which are toxic to nearly every molecule. With the buildup of these poisons, organs fail, cancers emerge, and heart disease occurs until eventual death follows. There's support for this theory since we know that certain metals build up in the organs, and the body becomes less efficient at discarding wastes. Antioxidants can reduce free radicals, and genetic traits associated with the natural defense against free radicals have been identified. Fruit flies have been bred to live the human equivalent of 150 years. The autoimmune theory suggests that as we age, our immune systems become less efficient and can even attack the body's own healthy cells, as we see with autoimmune diseases like rheumatoid arthritis. Shingles can flare up in adults who previously had chickenpox. Vaccinations don't work as well with the elderly, which is one reason the flu, when it's a new strain that the person doesn't already have antibodies against, is especially dangerous. S.J. Olshansky argues that it's not that we're programmed to die so much as we're not programmed to live much beyond our reproductive years. Some theorists point to hormones to explain aging. Reducing pituitary hormones, for example, can delay aging, and increasing growth hormones and DHEA can enhance the metabolism and stimulate organ functioning. Replacing DHEA can prevent abdominal obesity by aiding the body's regulation of insulin and blood sugar. In the longevity assurance theory, George Sacker posits that we should ask why humans live as long as they do, rather than asking why they die. Among long-living species, natural selection has favored genes that repair cells, allowing the organism and its future generations to live longer. There are three primary ways to slow aging: diet and lifestyle, using modern medicine to replace growth factors and hormones and to fight disease, and using drugs, body or stem cells, and gene therapies to extend life. Estimates are that by 2070, women will live to an average of 92.5 years to 101.5 years. Many fear that cognitive decline will occur with age. However, most continue functioning at relatively high capacities. Aside from minor lapses in memory, which can begin as early as age 40, with healthy eating, exercise, social engagement, and the absence of debilitating diseases, most can still do what they've always done, even at high levels. They remain flexible and resilient, and their brains still exhibit at least some plasticity when one area of the brain takes over a function for a failing area. Older adults are still able to learn new things, although it will take longer. Numerical abilities peak in midlife, do not change much into old age, but then suffer a significant decline in the 80s. Perceptual speed does seem to progressively slow down as the communication between neurons slows. There are numerous variations among individuals. Some older adults stay quick. Verbal abilities don't actually peak until the 60s, and then decline is only slight after that. Many researchers argue that older adults should be evaluated in ways other than standard intelligence tests because their brains work differently than younger brains. Gisela Lebouvive argues that older adults approach everyday problem solving differently, applying context to their decisions, and evaluating the impact of proposed solutions to their emotions and mental health. They personalize their tasks and consider many alternatives before settling on a solution. They reason by intuition rather than exclusively using logic. If a woman gives her husband an ultimatum that if he ever drinks again, she'll leave him, if he then drinks, a younger person would expect the woman to leave, while an older person might want more information and take into account the fact that the man just lost his best friend and only had one drink. The use it or lose it principle applies across the lifespan. So if older adults don't ever utilize information or engage in complicated cognitive tasks, those abilities will decline. K. Warner Shea has identified factors that reduce the risk of cognitive decline: good health in the absence of chronic diseases, above average education and income, stimulating pursuits, and an intact family. A complex and stimulating lifestyle filled with reading, social activities, travel, and educational pursuits. A flexible and adaptive personality at midlife, and a spouse who has high cognitive capacities. Although the speed with which we access memories and complete tasks declines, crystallized intelligence or wisdom continues to increase well into old age. Because it's more likely for an older person to be approaching death, studies of older adults likely unintentionally captured individuals passing through what's called the death drop effect, when we see significant decline immediately before death. Researchers then concluded that mental abilities decline dramatically with age. There is some decline, and things definitely slow down, but it's not as dramatic as previously assumed. Older adults sometimes can't recall individuals' names, but that might not be because their memory is failing, so much as they simply have more names to search through with such a large pool of names from greater life experience. Working memory tends to decline. However, cardiovascular exercise can increase blood flow to the brain, which can result in immediate positive effects to memory and other cognitive tasks. Certain medications, such as anticholinergics for incontinence, can negatively impact short-term memory, but long-term memory often remains exceptional. Sometimes older adults can remember songs they learned at 4 or 5. Verbal abilities actually continue to improve through old age, especially if physical activity is maintained. Memory is often described using computer lingo: encoding, storage, and retrieval. Memory failures can occur at all three stages. If memories aren't encoded or saved at all, or if they aren't properly stored, labeled, and organized, then they might not be able to be retrieved. If adequate cues aren't in place, retrieval can be difficult. Older adults find it harder to process new information, making the encoding stage more difficult, but they're better able to use their previous knowledge to solve routine problems. They have more storage problems, placing memories in areas they won't be likely to find again, and retrieval problems, having more trouble than younger people in remembering important source information. Older adults have more trouble identifying the important information that will allow them to retrieve stored memories. They sometimes suffer from a decline in focus, selective attention, more difficulty in performing multiple tasks at once, divided attention, and difficulty sustaining attention to accomplish long-term tasks, all of which can result in them feeling overwhelmed. Two theories attempt to explain memory difficulties: the decay theory and the interference theory. With the decay theory, theorists believe that certain traces or memories simply fade away gradually with time, especially if they aren't accessed or used often. In the interference theory, either new information or old information can interfere with what we're trying to learn today. As more information competes for our attention, we have more trouble recalling desired memories. Although older adults are slower and have more trouble with memories than younger people, that does not mean that they're unable to learn new things. They just need more time and will not be interested in learning information that they think is unnecessary. We used to think that after 70, lives would end with senility, which is mental deterioration, disorientation regarding time and place, irritability, confusion, and other personality differences. Now, we know that without neurocognitive diseases, this is not an absolute. Again, while memory and speed can decline with age, overall knowledge remains stable up until age 90. After 90, there is decline, even in overall knowledge, which lends support to the lifespan theory. Women and those who enjoyed higher income and educational levels typically maintain higher levels of cognitive functioning. Often senility is diagnosed when physical ailments like tumors, vitamin deficiencies, especially vitamin B and folic acid, anemia, depression, hyperthyroidism, chronic liver or kidney failure, and toxic reactions to drugs are missed. Many of these conditions can be reversed if caught and treated fast enough. Stroke, Alzheimer's, and Parkinson's can be debilitating. A stroke occurs when a blood vessel that delivers nutrients and oxygen to the body's cells is blocked by a clot, or when it bursts and releases blood into the brain. Strokes are the third leading cause of death among the elderly and the main cause of severe debilitation. The signs are sudden and include numbness, especially on one side of the body, in the face, arm, or leg, confusion and trouble speaking or understanding, trouble seeing in one or both eyes, difficulty walking, dizziness, or poor balance, and sudden or severe unexplained headache. Call 911 if you see any of these signs. If people survive a stroke, they often must undergo rehabilitation, sometimes working with a speech pathologist to relearn how to speak. About 20 to 25% of all senility results from multi-infarcts or mini-strokes. Often these little strokes are a precursor to a major stroke. Parkinson's disease is a progressive brain disease that occurs when the neurons involved in dopamine production and release die or are damaged. Dopamine makes coordinated, smooth movement possible, and without it, tremors, shaking, stiffness, and slowness result. Research focuses on stem cells and genes, and in treatment, deep brain stimulation and drug therapies have been shown to alleviate symptoms. James Fowler, a minister and professor, sees great protective effects in people who have faith. He developed 7 stages of faith development, but his theory is flexible, not as fixed as some stage theories. The 5th stage typically occurs in midlife and older age, conjunctive faith and the inter-individual self. In this stage, people grow to understand that differences can coexist and that the world's religions are actually more similar than different, sharing a common core of truth. In the higher stages, people are able to transcend the focus on themselves to focus more on others, like Gandhi and Mother Teresa. Few people actually reach these higher stages. Other theorists seem to recognize the importance of faith, especially in later life. Both Kohlberg and Piaget considered adding final stages that incorporated a consideration of faith.